My girl Jasmine. How
Hey,
you doing, girl?
I'm doing beautiful. No complaints.
It's a beautiful day, isn't it?
It is.
And
It
you look
is.
beautiful.
I'm trying to match you.
Oh, listen to you. Listen to you. Tell the people who you are, Miss Brooks.
Okay, I'm Jasmine Brooks. I am the director for Iowa Healthiest State initiatives. I do our health incentive programming around Double Up Food Bucks. Here to talk about all the good things we do as an organization.
Yeah, so let's jump right into it. What are the good things you do as an organization? Because I don't know if everybody knows your organization and the services provided.
Yeah, well, really, the goal is to create more opportunities for Iowans to be healthy. And so most people would know us through our annual walk that was just completed in October. And really, that is, trying to get all 99 counties to be involved in some type of movement in the day and walking as a community, right? I think that's so vital and a vital piece that I appreciated when I, was trying to come on board and hired for my position. We also have a program called Make It Okay. We really want to help establish is bringing more mental health awareness amongst community members, and so really helping people to understand how they can understand mental health, how can they engage around mental health, and support our community members that struggle more through resources, through affirmation and everything under the sun regarding that. My program, Double Up Food Bucks, it's a health incentive program where we really try to incentivize people to eat healthy, so fresh produce. We have 79 counties that we serve and over 172 locations. So we partner with just local grocery stores, our farmers markets, and farm stands and CSAs to help bring more fresh fruits and vegetables. We also have produce prescription, similar to Double Up Food Bucks, where we try to support folks that are chronic and chronic illness around diabetes, and so helping to bring more fresh produce. I think people don't understand that health and food go together, right? So if I am unhealthy, just giving me medication isn't going to help to reestablish positive behaviors to, overall health within our family. So we look at the entire family unit
Okay.
and provide produce to help us reestablish and help to support their goals of having lower A1Cs. So yeah, I would say we do a lot of other things. We are educators, we are advocates, we partner with other organizations just to bring again back to that holistic understanding of how can we make more healthier Iowans.
So I want to back up a minute on something that you
Yes.
said that I do feel needs to be stated again and talked about a little bit more.
Yes.
And that is nutrition
Yes.
and what we put in our body
Yes.
and how that relates to our health. We are in a very fast paced environment here in the US. We're working constantly. We go for convenience. I'm guilty of it too. I'll go for that thing that's more convenient because I haven't done my meal prep like I was
Hey, that two
supposed
for
to.
four though. That 2 for 4.
Girl, and we're around the holiday season, so all the seasonal stuff's coming out now. That's just calling your name, the
Carbs.
pumpkins and the girl, carbs and me. That's my friend.
And bread.
That bread, all of that. How do you help people through the organization to
Yeah.
understand the importance of nutrition and why it is important to whether you have to eat your vegetables or you have to drink your vegetables,
Okay.
however you have to get them vegetables in you and that produce in you and that fresh produce too. How do you go about helping and educating people to understand that?
Absolutely. I feel like we focus on higher level thinking of access. If I'm over here telling someone in a doctor's office, I need you to eat healthy, that is difficult for so many reasons. We look at our rural counties, we think about people having to travel far distance for grocery stores. Grocery stores are not as common or available to people. So if I'm going to shop, I may be shopping every once or twice, in a month. I think about too access regarding economics. So people having, financial ability to buy. I mean, fresh produce is expensive. Anything that is healthy for you is oftentimes more expensive and costly. And for our low income families, having to choose between rent and eating is always that conversation. And I think too about behavioral change. So if we are introducing a program, what it does is not only incentivize you to to eat, but your children and anyone in your community is seeing the effects of that, even from down to the cashiers. People just thinking that folks that are low income or poor, impoverished, just choose to eat unhealthy, that they have other alternative options. Well, I'm also helping to introduce a concept that is not true, right? That is not how people want to engage. I think everyone wants to eat healthy. I think everyone wants to be well, but people are having to make choices. And commonly, food is the number one thing that goes first for a lot of people. Is they're going to not eat, or they're going to choose to eat what's convenient, or choose to eat something that isn't necessarily like and supportive of what their bodies are needing. Because you're seeing the kid falling asleep, you're seeing the lady in the front desk, angry. I always say people hungry. Because I know I'm hangry. If I don't eat and I don't eat well, I'm snapping on everything.
Right.
So I always tell people, what'd you eat today? What's going on? And what's nice about our program, too, is we do get to engage with our users. And a lot of them being older population, we forget oftentimes that a lot of these rural places have an older population with chronic illnesses, and so they're wanting alternatives, options to be able to stay well for their grandchildren, to be here, to have to work to take care of their families, just like anyone that is young, and so I think all of that it just really pushes me to bring more options, because we could talk all day about eating kale. I hate conversations around kale. But how can I talk to you about this squash? How can I talk to you about this pumpkin? How can I talk to you about this greens, right? What do you want to eat? And so we're getting there. We got a new grant that allows us to introduce food navigators, and really helping to establish more conversation and education in the community that we're serving in the program.
That's amazing. That's amazing. Because, I'm in the fitness world, so I do health stuff, and nutrition is one of the hardest. It is a hard thing to do, and, it's interesting that a lot of people, they just neglect that part of their life. And if you're not well, you cannot do everything else that you want to do. And so it's so important that we have this education, this knowledge, and do it in a way where people don't feel judged.
Exactly.
Where they feel it's a safe space, and they don't feel that they can't accomplish it. So if people wanted to find out more, get connected with you, find out more about your services, the resources, the organization as a whole, what's the best way to do that?
Yeah, I would say, from calling us, leaving a voicemail, to sending an email, we're pretty accessible, and I think that's what's nice about being small and mighty, is that any collaboration we welcome. We're always doing things throughout the year, and so even if it's just having dialogue about what we want to do, contacting us through our website, IowaHealthiestState.com, or through me specifically, looking at doubleupfoodbucks.com. I think that is just, we're here. We always get this idea that we are a government agency, and we are not. We are a local nonprofit, a mighty team of 7 people who are passionate and dedicated, and so we're always willing to have dialogue and conversation about all the things under the sun when it comes to health and wellness.
I love it, and we need more people and more organizations like you. Well, maybe not more organizations, but more people to be focused on that, because I think if we have too many organizations, that can get overwhelming too. But we do need a lot more focus, knowledge, passion, purpose around that. Because unfortunately, our United States of America is getting kind of big. It's getting kind of unhealthy. And so
we there already.
And if we don't stop, it's going to continue to get worse. So I appreciate all that you do. Thank you for coming out to the conference and having this conversation with me. I appreciate you, and I hope you enjoy the rest of the conference.
Thank you. Excited to be here.
All right.